Hello. Sorry for the.
No, that's okay. That's okay. Yeah.
We are discussing with Dr. Satish Satish Chandra, President of College of Internal Medicine, Sri Lanka, and our college group of 85 distinguished boys. And we will continue with the doctor. Now, we were talking about the post-COVID.
Yes, that's right. Yeah. So, so what I said was that most people will clear COVID well. So most of them will not have any long issues. Of course, for about a month or so, they can have feel a little tired, can have a bit of fatigue, and maybe on trying to do some exercise, the heartbeat can be a little rapid. So some minor symptoms can be there. We generally say for most people to rest. Like say, I mean, it's probably not a good idea to start, going to the gym immediately. I mean, it's best to wait for a couple of weeks, see how you are, and then restart. If you feel well, I mean, there are people who feel quite well, say just about 10 days after the illness, so then they can go on about their normal things. But if you feel a little tired, don't push yourself too hard. I mean, not doing exercise for a couple of weeks will not hurt you that much. So just get a bit of rest, drink plenty of fluids, eat good food. No special drugs are needed. So you will generally clear the. I mean, you'll be okay by the in the first week. I mean, by in about a couple of weeks. But there may be a small percentage of people, maybe about say 10% or a little more than that, who will have some symptoms going on. Now, they can have, mostly they are the people who had severe COVID during their illness, like say who had severe pneumonia, people who had, maybe heart issues, because COVID can affect the other systems as well, really. So those people can have symptoms going on. Now, what we do is we get them down to clinics or to, outpatients departments, and we check on them. Some patients may have to be on steroids for a longer period, maybe for about, like say drugs like prednisolone, for about 2 to 3 months. So that is a minority. So because sometimes rarely with severe COVID pneumonia, you can end up with a little lung damage. You can have what we call fibrosis of the lung. That can be in a small area, it can be a little more widespread also. So in that situation, of course, we will have to treat the patient with steroids, and those drugs will have to be continued. So constant monitoring will be needed. But that is not in a majority of people. So I think we should not be sort of overly scared about post-COVID issues. Of course, they can happen. We must be vigilant about them. But I mean, so the simple thing to do is, if you have any issue, speak to your GP or your consultant, and then they will sort it out for you. And minor symptoms like, little body aches, a little tiredness going on is normal. That's natural. I mean, that can happen with any viral illness. I think you may remember there was an epidemic of chikungunya virus some years ago, and most people were left with joint pains going on for quite some time. So and they all recovered. I mean, so it's something that we should be careful of, but we should not be too scared of it, and should not panic about it also.
Okay. Now, this is with COVID and beyond that as well. Now, when we talk about accepted drugs or accepted vaccine or whatever, I mean, all these should go through a proper approval process. All the drugs are subjected to approval from the WHO, or are there any local approving authority, or how it will work?
Yeah. So now there is a local authority called what we call the NMRA. NMRA is National Medicinal Regulatory Authority. So that's a body that has to approve all drugs. Whatever drug that comes into the country has to be given approval by the NMRA. and the NMRA has various scientific committees where doctors are there, specialists are there. So they go through the product literature of a particular drug. They go into details about where it has been used before. They will always check with the WHO as well, whether those drugs or vaccines have been approved by them. So it's a quite a rigorous process, and it's not easy to get approval from the NMRA for any product. So once that approval is granted, then of course there's another stage where, so that is the NMRA has allowed a certain drug to be brought into the country. But then there are other committees outside the NMRA as well, committees that sorry. There are other committees within the health ministry which will also go through those drugs, and they will incorporate them into guidelines. So certain drugs that are there that have been approved by the NMRA for one indication, let's say for one reason, may not be given for another reason. So that is right. So those health ministry committees will form what we call guidelines. So they will guide therapy. Now, for example, if you take for COVID-19, there is a specific guideline where the health ministry spells out the management. For dengue, there's a specific guideline. So there is a guideline, and physicians and doctors are expected to follow the guideline. Of course, they can make slight adjustments, but then they have to take responsibility and do that. So it's a well documented process. So whatever drug or vaccine that is in the country is supposed to have gone through those approvals. But of course, there are now, say in the market, there may be smuggled drugs and smuggled preparations. Now those may have come in through other routes, so those cannot be avoided. So again, it comes back. It comes back to the basic principle we talked about. Before taking any drug or preparation, you must find out exactly whether those have been approved by the appropriate authority.
And the other thing is now there are a heap of people who are trying to find a drug or find a medication for this particular COVID, and they say that they have done this and done that, and they're talking about different things, and they say that you won't have any problems and so on and so forth. But it has to go through this process for NMRA to approve. Because now, say, as far as I can understand, NMRA is so rigorous about this is for the greater benefits of the benefit of the society, rather than sort of getting somebody to come up with a drug or something like that. So is this rule? Is this rule is applied to the all imported vaccines as well? Now, all to be very straightforward with AstraZeneca and Pfizer, Sputnik, and other things are also gone through this particular process. Have those also gone?
Yes. Yeah. So all vaccines now, NMRA. That's right. Yeah. So all the vaccines went through the same process. So actually, all the vaccines that are used in Sri Lanka are approved by the WHO. So, and they're approved and given in certain other countries also. But even Sinopharm now, say, of course, Pfizer, AstraZeneca, Sputnik, Sinopharm, Moderna, those are the 5 vaccines that are used here. All those vaccines have been approved by the WHO and approved by the NMRA as well, the National Medicinal Regulatory Authority. Yeah. Yes.
Right. So basically that is that. Once again, we are really grateful to you, Dr. Harshit Satish Chandra, President of College of Internal Medicine Sri Lanka, and distinguished old boy of Royal College Group of 85. And we are really grateful to you, because this effort is for us to sort of give whatever the insights for our members as well as whoever who is concerned. Whereas it's a very helpful thoughts and helpful guidelines that you have given, and we are so thankful to you. Thank you very much for joining in. Thanks a lot.
Thank you, Christy, for giving. Yeah, thank you, Christy, for giving me the chance to explain certain matters. Also, I think it's important from our side also that we explain matters. On a final note, I think what I can say is, now this pandemic has been quite a shock to all of us. It has disrupted our normal lives. So we must, sensibly try and survive this pandemic. I think that's what we should do. So we have, few things that we have to do that. Number one is to take the vaccine, because it's important for us to vaccinate all of us. Very few people cannot take the vaccine. The vast majority can take the vaccine. And if you're not sure whether you can take the vaccine or not, just consult a doctor. They'll be able to go through your history and tell you whether you're fit to take the vaccine or not. Actually, from our experience, it's in a very, very minority of people who cannot take the vaccine. And but even after taking the vaccine, it takes about 2 weeks, even after the second dose, for you to develop full immunity. So it's important for you, especially within that period, to adopt other health measures. And even after that period, even after you're protected, even after you have got immunity, it's important for you to wear a mask, keep distance and all that, because you can then, for two things. You'll be blocking the virus entering the body anyway. That's the first defense. And also you'll be stopping yourself from passing the virus to another, maybe non-vaccinated person, because mostly our children are not vaccinated, and there's a younger group of people. So it's our responsibility as well, people who get the vaccine, not to adopt these health measures and prevent passing on the virus to others until they all get vaccinated. So that's important. Then the other important thing, I think, it especially applies to our age group. I think, this is the age group where we develop other illnesses, pressure, diabetes, heart issues. So it's a time for us to be to control those very well. Like say, if, of course, at any time we have to control, but even if we had been a bit if we have neglected in the past, but this is the time we can't neglect ourselves. So we have to treat ourselves well, get medicines, and so that, because we find that deaths and complications occur in people who have uncontrolled illnesses. So it's all right to have diabetes if that is controlled. It's okay to have pressure if that is controlled. So this is the time we must sort of rethink and maybe change our lifestyles as well, if possible, to make sure that our illnesses are controlled, so that even if in the unlikely when the virus strikes after vaccination, we will still be protected. So I think that's the final thing. And of course, believe in the scientific method, believe in whatever drugs that are sort of scientifically proven. It's okay to look for new things. That's quite all right. I think we should promote that. Whether it's a herbal drug or it's a Western drug, it's okay to look for new things, but they should go through a scientific process. And then, there are, drug authorities. In the herbal sector, there is this Ayurvedic Council. Then in the Western sector, there is this National Medicinal Regulatory Authorities. So those bodies are there. So once they've gone through those bodies and they have adopted, then of course we can safely use them. So I think even though it's a sort of a situation that causes panic, we should restrain ourselves and stick to accepted forms of treatment. That is the thing that I have to say. Thanks. Thank you.
So I'm Christy here from Royal College Group of 85. We profoundly thank you, Dr. Harsha Chandra, the President of College of Internal Medicine, Sri Lanka. Our own colleague, own boy from Group of 85. Thank you very, very much.
Okay, welcome. Good night.